This is a wound on the back of the leg which requires a special attention. Its attention getting requirements include the fact that this is a lady. She's a working lady. She gets out and works, but she's still a lady. She's got a lot of sun damage. The skin's thin. That means it tends to bleed easy. There's a few little red spots that you can see where she's had some bleeding just from touching her skin. This has been a place that's been tender and sore, partially the reason it was removed, but more important is that this is an area that lies right above her Achilles tendon and the large muscle that goes down to it. What that means is it's easy to disrupt the blood flow to this area. It's easy to disrupt the wound. It's easy to make the wound pop open. So she's going to have to take it easy for the next 2 weeks, which we may hear objecting in the background. I hope not. To help her, I put some stitches in, and there's 3 of these that are off to the side called bolster stitches. Now that is making this wound pucker up, but in doing so, that means that she may have to have these bolster stitches removed if they cause too much puckering, if it causes a lot of soreness and tenderness. She's already got a sore, tender place, but if these places seem to make it even sore and more tender over the next few days, she'll have to return and we'll have to get these out. There's 3 of them here. She also has some other stitches which lay right across the wound. Those also have to be kept into consideration as well if there's any redness, tenderness, or soreness. And then I'll let Kathy talk about the rest of the wound care in just a minute. But I wanted to talk about these bolster stitches, as they're called.
What you need to do is, when you feel the tingling coming back, that's the feeling coming back, you need to take this glove, crush up some ice, put about 2 tablespoons of salt in the glove, and you're going to hold it on the wound. You're going to do that 10 minutes out of every hour. That'll keep it from bleeding, hopefully. After that, tomorrow you should be okay, but he wants you to call us anyway and let us know. The bandage I put on, take it off tomorrow and leave it on. Leave it off.
Okay.
Little Vaseline on the wound instead of polysporin now. We don't go for polysporin, only for today. So starting tomorrow, rub a little Vaseline on the stitches. Keeps them soft. Do you see where it's puckering?
Yeah.
If that don't lay down, in a couple of days we can take those pucker stitches out. Because that's actually may keep this real sore, so just keep that in mind.
Okay.
Then other than that, getting it wet tomorrow, taking a shower's fine. You do not want to be on your legs more than 30 minutes out of each hour. So that means you have to sit, prop your legs up. Walking's fine.
Our revival meeting is going on.
When you're sitting, prop your legs up.